Okay, so good afternoon, everyone. And here we are for our second lecture on proctology. So we'll be discussing about MDT. How is MDT useful in proctology? We've talked about MDT in cancer patients, but we have seen through a lot of studies that multidisciplinary approach helps in other patients who have a very debilitating pain, illness that is beneficial when multidisciplinary approach is taken, where experts from many other fields who take part in patient management, they decide upon a plan together rather than individually. So today's topic is multidisciplinary approaches in anorectal and laser proctology. Here we'll be discussing about the integrated care pathways for better outcomes and complex anorectal disease. So instead of the whole list that I usually provide in my classes, there's just one objective in today's class. It is to understand the role of a multidisciplinary team in comprehensive care of anorectal disorders, and then integrating the collaborative strategies for optimal clinical and functional outcomes for the patients, with learning outcomes being explaining why MDT care improve outcomes in the colorectal disorders, identifying the roles of various departments like gastroenterology, colorectal surgery, physiotherapy, dietetics, very important dietetics, and yes, pain teams, and of course, psychiatrist and psychological support as well. Coordinate the workup and treatment for rectal cancer, IBD, pelvic floor disorders, as these are all linked and related to each other. Optimize the patient perioperatively, especially the ones that are high risk. Utilizing MRI and endoanal ultrasound, these are the advanced technologies that we use for complex diagnosis and decision making. Practice shared decision making and patient-centered counseling, and address psychological aspect like I was mentioning before, such as incontinence, chronic pain, and stigma. Now, why does proctology need MDT care? Because anorectal diseases are not just local problems, they often involve chronic inflammation. For example, inflammatory bowel disease, including Crohn's and ulcerative colitis. There could be infection and sepsis that is leading to fistula formation because of infection and inflammation of the perineal glands that have gotten infected. They burst out, they rupture with pus, and then a fistula forms. There could be functional disorders causing a lot of discomfort during passage of stools, sometimes even incontinence, and labeled as pelvic floor dysfunction. Oncological pathways, well, we'll discuss a bit about rectal cancers, as sometimes rectal cancers definitely need MDT care and quality of life impact, like pain. There is embarrassment because of staining of the clothes and incontinence, and therefore the best outcomes that come from integrated care are not isolated procedures. So this is one video I would like you to pay attention about teamwork in general.
One of the key elements of success is teamwork. Now, teamwork works like a clock. For a clock to work at all, you need all the parts functioning properly within a collaborative setting. In healthcare, many professionals work interdependently to achieve a common goal: patient treatment. So, what benefits does teamwork have? It improves quality of patient care, reduces length of stay, enhances patient safety.
Urological endoscopy is a minimally invasive diagnostic and treatment technique. It allows doctors to see inside the urinary tract without open surgery. It examines the bladder, urethra, ureters, and kidneys. Special instruments like cystoscopes and ureteroscopes are used. High-definition cameras provide real-time internal views. It helps in stone removal, biopsies, and diagnosis. Patients recover faster with minimal discomfort. It is safe, precise, and highly effective. Expert training is essential for successful outcomes. Upgrade your skills with advanced urological endoscopy training.